Hi, this is Dr. Jeff Snyder. Thanks for watching this video on the New Patient Chiropractic Workshop. This presentation will be done by a friend of mine, Keith Wysong. Keith is a chiropractic advocate and has a great way of communicating the chiropractic message regarding health and how that might fit into your equation in taking care of yourself and your family. So without further ado, please enjoy the video and I'll see you right afterwards.
Good evening. My name is Keith Wysong. Welcome to tonight's presentation on chiropractic. The purpose of this class is to give you quality information to allow you to make quality decisions about your health. Now, this information can do one of three things. Number one, it can change your health for the rest of your life. Number two, it can change the health of every single member of your family. And number three, it could potentially change the health of every single person you ever meet for the rest of your life. You might think that's a pretty bold statement. Well, I'm going to ask you 40 minutes from now if what I just said was true. But in order to give you this information, I need permission of every single person in this audience to just tell it like it is, to just cut through the fluff and tell you what I want to tell you, because honestly, it's going to challenge a lot of what you've always been taught and believed about health and how your body works. It's going to make some of you uncomfortable, might make one or two of you mad, but I would rather risk making you uncomfortable for 30, 40 short minutes than for the whole audience to miss out on the potential benefits of this information. Now, I'm going to cover a lot of facts and figures, a lot of data, a lot of research. And if you're like me, you probably want to know, where'd you get that at? What's your source? Are you making that up? You know what? Sit back, relax. At the end of this class, I'm going to hand out a workshop feedback sheet where you're going to get a chance to get a copy of every single piece of research in the form of a research packet that we have. You really enjoy them, so just sit back, relax, let's get started. The United States has the most extensive healthcare system of any country in the world. We have more doctors. We have the best trained doctors, surgeons, nurses, laboratory workers. We have the best medical schools. We have the best hospitals in the world. The U.S. leads the world in medical technology and research. About 94% of new medical breakthroughs, new drugs developed, new life-saving procedures happens in the U.S. or a U.S.-sponsored laboratory in North America. We spend more on healthcare than any single country in the world. Last year, it was $2.7 trillion. What's interesting about that number is it's doubling about every 8 or 9 years without any appreciable change in the population. Right now, the Office of Management and Budget of Congress said if we don't change our approach to healthcare, that number could be in excess of $20 trillion in the next 18 to 20 years. So what are we getting for all these resources? What are we getting for $2.7 trillion? One thing's for sure, when it comes to emergency care, crisis care, trauma care, the kind of care where if you weren't seen, you might lose your life, lose the use of a limb, suffer a permanent disability. When it comes to those kinds of conditions, we're the best in the world. We have the best burn centers, the best emergency rooms, the best at saving lives from injuries and things of this nature. When it comes to these kinds of conditions, the U.S. healthcare system is the best in the world. But crisis and emergency health problems account for less than 1% of all healthcare problems. So how well does our healthcare system do at handling the remaining 99%? Of just everyday functional, non-emergency, body's not doing what's supposed to? How well does our approach do at the majority of healthcare problems? Well, according to the World Health Organization, the United States ranks 79th out of 81 industrialized nations in the formula they call the Total Health Index. Now, sometimes you see that number as 37. They are 37 when the money is not factored into the index. What's interesting is in 1931, we were second in overall health. Over the years, as we spent more money, our trauma care has gotten better, our crisis care has gotten better, our ability to manage certain health conditions has gotten better, but as a nation, we've grown less and less healthy every single year. Heart disease, going up or going down? Oh, it's going through the roof. Heart disease used to affect middle-aged men who were overweight, smoked, and ate bacon 3 times a day. Now it affects all ages, all genders, young people, college athletes. Cancer, going up or going down, absolutely through the roof. Diabetes, 600% increase just in the last 15 years. Infectious disease, this is like resistant microbes and swine flu and things like that. The Center for Disease Control in Atlanta says resistant microbes are the #1 problem affecting the human race. Autoimmune conditions, that's where the body actually attacks itself. It's something that's somewhat unique to the Western world. And iatrogenic, that means the treatment actually caused more problems than it corrected. And we all know people who take one medication and they end up taking 3 or 4 more, or they go in for a simple surgery and they end up down the road having to go a far more complex surgery. What has gone wrong? Why are healthcare costs in the United States rising faster than any other nation in the world, even as our overall health declines? The problem is not lack of healthcare coverage. The problem is our model of healthcare. In other words, our basic beliefs about what health is and what we need to do in order to achieve good health. Under our present model or our approach, our health is defined by how we feel. In other words, the presence or absence of symptoms. The approach or the objective then becomes to eliminate those symptoms in order to make one feel better. Well, there's a lot of problems with this particular model and objective. In many cases, you can be completely pain or symptom free and have a health problem. For example, you wake up in the morning with a really bad toothache. You call your dentist and say, I'll be there in an hour or two. 2 hours later, you're sitting in their chair and they look in your mouth and say, well, no wonder you have a toothache. You have a really bad cavity here. Now, the toothache, the pain, the feeling, the symptom, it's been there 2 or 3 hours. How long has that cavity been there? Weeks, months, maybe even years. See, what's true about symptoms, they're the last thing to show up, which means they're also the first thing to disappear. It's why dentists don't treat toothaches with Tylenol or aspirin or painkillers. It would not get to the source of the problem. One of the most common first signs of coronary heart disease is death by fatal heart attack. It's not a warning sign. Symptoms are not a way of warning you that something's wrong. They're the end result of a health condition. We can no longer afford to base our health on the presence or absence of symptoms or in simply how we feel. There's another reason we cannot eliminate symptoms as an approach to health. We'll come back to that in a few slides from now. But do you realize there's not a single scientific medical textbook in the world that even defines health based on the presence or absence of symptoms or simply how a person feels? In fact, all of the definitions of health say just the opposite. They talk about health in terms of wholeness, completeness. They always talk about health in terms of how a person's body is functioning. So we always want to look at health in terms of function, optimal function, every organ, every cell, every tissue functioning like it was supposed to, individually and as a collective unit. Function is a structural thing. Therefore, it's variable. It can fluctuate. It can move up and down. Health really is all about maintaining optimal function. Well, let's take it a step further. The word health comes from the word heal. Health is literally your body's ability to heal itself. Its old cells being replaced with new cells. We can relate to healing if we have a cut or maybe a broken arm, but really healing, cell replacement, happens all the time. We learned about it in high school in mitosis. Our bodies are constantly in a state of replacing old cells with new ones. This happens our entire lives. Why? Because we're designed or born with an innate intelligence which always is at 100%. Innate intelligence is either on at 100% or it's off at 0. There's no middle ground there. Well, think about it like this. Billy Joel comes to town, and you get 2 tickets to see him, front row center. Billy Joel, very talented piano player. And he comes out on stage, and he sits down, and he plays his signature piece, which is The Piano Man. And he plays it perfectly, flawlessly, because he's a very talented piano player, and he's probably played it 20,000 times in his life. But the backstage crew didn't tune the piano. A couple of the keys are stuck together, and one of the pedals is gone. What's the music going to sound like? It's going to sound bad. Well, wait a minute. Why couldn't Billy Joel, the world-class musician, make up for those structural deficiencies? Well, if he's already playing it perfectly, he's limited by the configuration of his instrument, his piano, in the same way that innate intelligence can only express itself as well as the structural configuration of the human body. So function is like the piano. It's our physical structural body. Innate intelligence is like the talent of the piano player. Health is like the music. It's the expression. It's what we get. We can't make the body any wiser than it already is. All we can do is work at improving, restoring, and maintaining function. And folks, the purpose of healthcare, all healthcare, is not to eliminate symptoms. It's not to simply make you feel better on a short-term basis. It's all about function. Earlier I had mentioned there's another reason that eliminating symptoms is not a very good approach in dealing with health and health issues. Here's why. Imagine you go to a movie theater and you've got your popcorn, you've got your lemonade, and maybe you're watching the previews, and there's a person sitting next to you, a man, and he's coughing and he's sneezing, and you look over and he's got green snot running out of his nose and down his cheek, and he's running a fever because he's all sweaty. You can almost feel the heat coming off this guy. And he leans forward in his seat and he begins vomiting up all kinds of popcorn and gummy bears, really disgusting. And he's grimacing because he's in pain. And then you hear this strange sound, and you know this guy's got diarrhea, and he's sitting right next to you. What are you going to do? Change seats? Leave the theater? I might even leave the city. I wouldn't want to sit next to someone like that. But think about it, and this is important. We have been taught, we've been conditioned our entire lives to believe if a person has symptoms, if they feel bad, it's because they're unhealthy. Well, let's go back to our formula about function and healing. And think about it. What's the body doing when it's coughing? It's getting rid of stuff. What's it getting rid of? Germs, snot, phlegm, mucus, toxins, debris. Good thing or bad thing? It's a good thing, healthy or unhealthy. It's very healthy because the body's functioning like it's supposed to. Sneezing, same thing. Fever, body's heating up to fight off infection. Vomiting, hey, if you have tainted food, a bad piece of chicken, the best thing your body can do is process it and get rid of it as fast as possible. Pain, along the lines of a warning sign, but there's also some healing physiology going on in there. Diarrhea is a lot like vomiting. Your body's identifying a toxin, liquefying it, and getting out of your system just as fast as possible. So you see symptoms, though they're uncomfortable, though no one likes them, they're actually not unhealthy. They're part of the healing process. And we've been taught to do what for symptoms? What do we do for a cough? We take cough suppressant. You mean you want to stop the body from getting rid of the germs, the snot, the phlegm, the mucus, the debris? Why? Just to feel better on a short-term basis? And so we take chemicals to stop the symptoms. When we stop the symptoms, we inhibit the healing process. As a result, we get side effects. Eli Lilly, who was the first drug manufacturer, said all drugs have side effects. What do we do for the side effects? Well, we just keep taking more and more drugs, chasing symptoms, never allowing our bodies to properly heal themselves. If you've seen some of the Pepto-Bismol commercials, they say Pepto-Bismol coats and soothes. And that's exactly what it does, because it's liquid plastic. See, when you have this bad chicken in your stomach and your body's attempting to liquefy it and get rid of it via diarrhea, you drink the Pepto-Bismol, it forms this giant paint chip in your stomach, which cuts off the toxin from the central nervous system. In other words, the central nervous system can no longer identify this as a toxin. So the symptom goes away because the healing process is interrupted, and now this toxin gets a chance to get absorbed into your bloodstream, causing further damage. The U.S. is the most medicated country in the world. Americans consume 68% of all the drugs in the world. And in constant dollars, we spent more than $300 billion on prescription drugs just last year. That's almost triple what it was in 1999. Now, I'm not anti-drug, because there's no doubt that drugs, when properly used, save lives. They work particularly well in short-term and crisis situations. But there's a big difference between taking a drug for one of those kinds of situations and taking it as part of a lifestyle. And we all know people who take drugs day after day, week after week for years on end. Their body's trying to function properly. It's trying to use those symptoms to heal itself, but they're never allowing it to. One of the reasons that we're so medicated in the United States is because of the pharmaceutical industry. Now understand, I'm not saying they're the bad guys, but you have to understand that they're interested in selling medication. And so their message is going to be aimed at symptoms and feeling. It's vital to their business interest to maintain our current symptom-based feeling model and to resist a function-based model. They are the most profitable industry ever in the history of the world. You know, if you go home tonight and you watch TV, count how many commercials come on in a 2-hour period and count how many of them are drug related. In most nights, it's right around 50%. The combined profits for the top 10 drug companies in the Fortune 500 are more profitable than the other 490 businesses combined. That means they have clout, they have money, they have influence. So does the pharmaceutical industry influence healthcare policy? Well, they certainly have the profits and the influence to do so in the amount of money they spend on advertising, marketing, promotion, in the amount of influence they have in dictating curriculums in medical schools, in terms of government research. They certainly are in a position to influence healthcare policy, keeping it at that symptom feeling model. We just have to be aware of this. So if our approach to healthcare is based on function, we have to know how the body functions. What controls that function? Well, every function of the human body is under the control of the central nervous system. Its job is to coordinate all the other organs and structures and to relate the individual to their environment. It does this by sending and receiving billions of nerve messages or nerve signals to the entire body. we can comfortably say that the foundation of health begins with a properly functioning nervous system. This is a fantastic quote from The Healing Brain. To understand health is to understand the central role of the brain and nervous system in maintaining the resistance of the body. Health maintenance is the primary function of the brain, not educational thoughts, language, poetry, and other functions usually associated with the brain. The quality of healing is directly proportional to the functional capability of the central nervous system to send and receive nerve messages. The central nervous system is so important, so vital to our health. It's protected by the hardest bones in the body, the skull and the spinal vertebra. Now, the skull is one solid piece, but the spinal column could not be one solid piece. It would make movement and bending and getting around very difficult. So the spinal column is made up of a series of individual bones called vertebra. When the spine is in its optimal structural position, that is, all the vertebrae are positioned correctly, they're moving properly, they protect and house those important nerve pathways. But because they're movable, they're also susceptible to certain stresses and forces which can cause them to lose their proper position. And then rather than protect the nerve pathways, they actually irritate or interfere with it. This is known as a vertebral subluxation. A vertebral subluxation is a minor misalignment of the spine which causes nerve interference and reduces the overall healing and functional capability of the nervous system. Subluxations negatively affect nervous system function. Imagine if you could open someone up, take a surgeon's scalpel, and actually sever a nerve leading to, say, their heart. What would happen to the heart? It would die in a matter of seconds. Well, what happens if you didn't sever the nerve? What if you could just interfere, irritate, do something to the pathway to slow down or inhibit the normal nerve supply? What would happen to that heart? Well, it would still die. It would die slowly over a long period of time. This is sort of an analogy of the effect of subluxations on nervous system function. So how would a person know if they had a vertebral subluxation? Can you feel it? Is it like a pinched nerve like you might get in a football game? Well, remember, pain and symptoms are the end result of a health condition. They're the last thing to show up. So we can't use pain or symptoms to evaluate whether we have subluxations. Also, only a small portion of the nervous system can even transmit pain signals. Therefore, we can't use pain to determine the existence of subluxations. The only way to tell is to be evaluated by a qualified health professional that specializes in the detection and correction of vertebral subluxations. A subluxation can be caused by any force or series of forces that the body cannot adapt to. They can be major traumatic, such as we see with the football sports injury type impact, as well as the auto collision. It's very common for someone to get a hit from behind, a little fender bender, and they say, I wasn't hurt. No broken bones, no blood, didn't have to go to the hospital. But the fact is their spine was jarred to an extent that subluxations occurred. But they didn't feel it right away, but their nervous system was still affected, and they experienced the effects years down the road. You can also have smaller repetitive type things. For example, a backpack, doing a certain occupational task. Even stress, repetitive stress, can cause subluxations. Another first cause of subluxation is the birth process. Even in a normal birth process, the amount of force that it's required to extract a child from the womb can cause subluxations to that baby's tiny, fragile cervical spine. Subluxations have been documented by leading health research authorities all over the world. Dr. Chung-Ha Soo said the weight of a dime on a spinal nerve will reduce nerve transmission by as much as 60%. Hyperfunctional or hypofunctional neurons along a neural chain prevent normal nerve transmission, causing disturbances in the homeostasis of the cells, tissues, and organs. This is an exact description of the effects of a vertebral subluxation. Here's another one. Subluxations of vertebra occur in all parts of the spine and in all degrees. When the dislocation is so slight as to not affect the spinal cord, it will still produce disturbances in the spinal nerves passing off from the foramina, one of the top neurosurgeons in the world. Pathological changes have been observed at the cellular level after experimental compression of neural structures. These include Wallerian degeneration, dystrophic axons, and occasional loss of myelinated nerve fibers. If you remember Christopher Reeves, the actor who played Superman, tragically he was out riding his horse many years ago. Horse tried to jump the fence. The actor fell off the horse, broke his neck, ended up spending his remaining years in a wheelchair, basically on life support. I mean, almost his whole life, his whole bodily functions were shut down. Well, what was it that caused that? It was major trauma to the nervous system. Well, if major trauma could shut a man's life down and cause him to die prematurely, what about smaller repetitive forces to a person's spine and nervous system, such as the things that we undergo every day in life? It's the same concept. Posture is one of the ways that subluxations can be evidenced. Think of an elderly person you know that's very healthy, has a lot of energy. You know, the 80-year-old lady in your neighborhood or your church just does all kinds of volunteer works, always running around 60 miles an hour. And everyone says, wow, I wish I had half of her energy right now, and I'm only half her age. We all know people like that. Well, think about it. What's her posture like? I'm willing to bet it's pretty good. Now, think of people you know, family, friends, co-workers who are much younger, but they're always having health issues and problems. What's their posture like? I'm willing to bet it's poor, and I promise you'll start noticing that in people you encounter, their health is going to match their posture. Here's some interesting tidbits and medical research about posture and subluxations. Posture affects and moderates every physiological function, from breathing to hormonal production. Homeostasis, that's the balance of the body's equilibrium and chemistry, and nervous system function are ultimately connected with posture. Abnormal posture is evident in patients with chronic and stress-related illnesses. You know, if you visit a nursing home or some sort of a facility like this, you definitely will see an awful lot of very poor posture on people that are bound in wheelchairs and have a whole host of health issues. Posture is finding its way into mainstream medical research journals. This is from the Journal of American Medical Association. Deviations in the body center of gravity, they're talking about posture, have resulted in intestinal problems, hemorrhoids, varicose veins, osteoporosis, hip and foot deformities, poor health, decreased quality of life, and a shortened lifespan. And despite the considerable evidence that posture affects physiology and function, the significant influence of posture on health is not addressed by most physicians. The beginning of the disease process begins with postural distortions. Dr. Hans Selye, Nobel laureate. Earlier, I had mentioned that the only way a person could know if they had a vertebral subluxation or subluxations was a careful analysis by a qualified health professional. Folks, that's what the purpose of chiropractic is. The purpose of chiropractic is to detect and correct vertebral subluxations by physically adjusting the spine. What they're trying to do is improve the overall healing ability of the body by restoring those nerve pathways. That's the purpose of chiropractic. Chiropractic is not a back doctor. Their job is not to make you feel better. Their job is to make you better to where you're functioning better and your body can resolve health issues. It's not a treatment for health problems or health conditions, but it's amazing how many times subluxations are corrected and the body's able to resolve a lot of chronic, almost debilitating conditions once it has a proper nerve supply. As I said in my opening statement, purpose of tonight's class was to provide you quality information to allow you to make quality decisions. And I hope you can see from this information presented tonight how this can change lives, families, communities, and potentially nations. There is one piece of information I've left out, one piece of information that you do not yet possess. Without this information, you really can't make a quality choice. That information is the current status of your spine and nervous system, how well your body is receiving and sending nerve information, you and your entire family. So really your next step is to schedule a careful analysis with a doctor of chiropractic in your community to see if you have subluxations. Then and only then will you know if you would benefit from chiropractic care. Now, let me address one thing. People will say, boy, I hear once you go to a chiropractor, you have to keep going. No, you don't have to do anything, but all good things in life, whether brushing your teeth, exercising, nutrition, relationships, require some sort of ongoing maintenance. The good news is once you get your spine and nervous system in shape, once you get those subluxations corrected and then maintain it on a regular basis, it's much easier for you to stay well adjusted. So chiropractic, when it's utilized best, is part of a lifestyle of regularly caring for and tuning up your central nervous system. I am now going to hand out the workshop feedback sheets. You can get copies of all the research we mentioned tonight. You can also get a copy of this video because I'm sure every one of you, as you were sitting here tonight, said, boy, I know a ton of people who really, really need to hear this information. They need to read this. They need a different approach to healthcare. We'll go ahead and hand that out, and I'll be happy to hang around and answer any questions. Again, I appreciate you being out tonight. Thank you very much.